The Networked Data Lab is a group of analytical teams across the UK using data to help system leaders understand how to improve health and care in our communities. I joined them as a carer to work on a project about intermediate care. My job was to help ask the right questions, interpret the results based on my own experiences, and share what we learned with my community. Intermediate care services provide support for a short time to help you recover and increase your independence. Intermediate care teams will work with you to achieve what you want to be able to do. This kind of support can be offered instead of a hospital stay or after you've been in hospital to help you recover more quickly. In my case, the patient I cared for benefited from intermediate care as it made their discharge home quicker and safer by getting aids and adaptations and access to healthcare professionals at a time when it was needed the most. Our project aimed to use routinely collected data to understand who receives intermediate care after a stay in hospital in northwest London and what makes the difference to the number of people who need to go back to hospital. We discovered that patients who are older, frail, and living alone are more likely to end up back in hospital within a year of being discharged. Fortunately, these groups are also more likely to receive intermediate care, which means care is being targeted well. However, we found that although men are more likely to need a further stay in hospital, they are less likely to get support from intermediate care teams. We need to think more about how to work out who gets this kind of care. We also found that intermediate care services may prevent people in more deprived areas from needing to go back to hospital. But patients who are male, frail, and living alone often need to go back to hospital, even if they are supported. We need further work to understand what helps to keep people well and able to live at home. Intermediate care can help you or your loved one leave hospital faster and might prevent unnecessary trips back. If you or someone you care for ends up in hospital, talk to a healthcare worker about discharge to see if intermediate care could support you to get home.